before, I had the honor of being Kamilah's dissertation advisor and worked with her for a number of years. For those of you who have been through this process, you know it's a long haul. Kamilah had actually finished all of her coursework towards her doctoral degree. She had passed with flying colors her two prelim exams, qualifying exams, one in health services research and another in sociology. And she had planned a dissertation. Her dissertation was going to be 3 separate papers on racial and ethnic disparities in children's mental health services. And Kamilah was very interested in exploring what some of the family issues were that prevented children from having access to and utilizing mental health services, family issues, institutional barriers, and again, with everything Kamilah did, she just didn't want to describe what some of the issues were. She was looking for the policy solutions and the interventions that would help increase, again, access and utilization. She had started in on her first paper in her dissertation at the time of her passing. And again, this is such a long process. I feel like she was really close to being finished, and I actually investigated with the Rackham Graduate School if they would be willing to grant her a posthumous PhD, and they were very sorry, and they said that she actually wasn't far enough along for that to happen, and that was very frustrating to me because, again, I've been working with her for 5 years and know how far she was in her thinking. I also have to mention that all the many wonderful times I spent with Kamilah, and those of you who know her can just, I'm sure, picture this. We would have meetings. I mentioned this to you before. Always had an agenda sent to me before the meeting, very organized, and she would show up with this ginormous book bag, sort of being, dragged on the floor behind her. She would come in, plunk her book bag on the floor, sit down in a chair with the heaviest of sighs, and say, "Okay, let's get started." And then she would stop for a minute and she'd say, "First, how are you?" Thank you for asking. She always wanted to check in first, but then she did have her whole agenda and her whole list of things we needed to get through. So again, I was so sad that she'd worked so hard for so many years and was so close, but the graduate school just has a policy they weren't going to let that happen. But I did realize very shortly after that Kamilah had actually completed all the requirements for a different kind of doctoral degree, and that is a doctorate in public health, a DRPH degree, that our department had offered in the past for people focusing on health policy. And it was very easy for me to do. I put together the documentation showing that she, in fact, had finished all the coursework. She had passed the preliminary exams, and actually she wrote a paper on racial and ethnic disparities in attention deficit disorder treatment among children that served actually as her dissertation. And so I am very proud and sad at the same time to be the Regents of the University of Michigan have awarded the degree of Doctor of Public Health to Kamilah, but I'm honored to be presenting to her parents right now Kamilah's diploma. So Dr. Neighbors.